Hey guys, it's Stephanie. My topic with Lulu and Gabby is hospice and aging population. The topic that I'm going to be talking about is pain management. There's two different types of hospice care. The first care is usually palliative. It's appropriate to aid in therapeutic efforts to help against a broad range of diseases. So your people that are in end-stage renal disease, or people who are on the end of their life but not quite in need of hospice yet. And then there is hospice, which is within the last 6 months of their life. And these are people with life-limiting illnesses. There's, I think, 7 or 9 different quota that you have to meet to be hospice. But in terms of pain management, they usually start with medications, usually over-counter, things like Tylenol and Motrin, things that you have access to as a person without a prescription. Usually they'll start there, and then once they move into palliative care and they say, like, that's exactly what I want to do, I want to start moving in that direction, then they start talking to all of their doctors and they agree. And once everyone's on that agreement, they kind of move up into other things that are more specific. So say you're having muscle spasms, then they're probably going to give you something like a Flexeril, that's a muscle relaxer. Or say that you're having pain in your neck and it's a nerve thing, then they'll probably give you like a nerve block or something like that. And then in hospice, they're allowed to give you narcotics, and they're allowed to give you more than they probably should if you were on palliative care. In palliative care, they do have to monitor your vitals, and they do have to make sure that you are breathing normally, and that they have to err on the side of caution just in case you stop breathing, because you're not quite hospice yet, so you don't want to die. But then they'll use narcotics in hospice, and they'll use usually a bigger dose than they normally do. If narcotics doesn't work, then they go to things like surgery. If it's a specific surgery that you need to have, then they'll usually go for that as well. And if they don't use medication, they can use, massages, baths, and just bringing someone in that the patient is close to and cares about. Just something like that that'll help them relax. And then when we're in the end of life and we know that it's probably going to be soon and they are on hospice, then they'll use a very strong dose of morphine or just anything that'll just kind of relax the patient. And then if they do kind of start to have respiratory depression and it kind of slows down their breathing, then they're not quite worried about that, because usually at this point they have a DNR and hospice is what they want. So they want to pass away, and they want to pass away peacefully with all of their family and friends, and they don't want to die in a type of situation where it's all crazy and we've done everything we can to save their life. So hospice is very calming for the patient, and it's usually a very nice way of dying. And because we're not afraid of the basis of addiction, we'll give them what they need in order to allow them to pass peacefully. So that's my section. I hope you enjoyed it. Check out our links at the end of the PowerPoint, and here's Gabby.